South Korea has seen a slight drop in the number of new infections of COVID-19 on Friday, but authorities say that cases will rise in the coming weeks when the Omicron surge will reach its peak. Accordingly, they are making preparations by tweaking some antivirus measures. Shin Ye-eun with this report.
South Korea on Friday reported 165,890 new COVID-19 infections. Despite the drop in cases, the number of critically ill rose by 74 to 655. The Prime Minister on Friday said Omicron will most likely peak by mid-March, when daily infections could surpass 250,000. He added how authorities will address the situation.
The government will supplement the country's medical system so that it can contain the spread of Omicron effectively. In order for us to do that, we will first take some of the burden off the overloaded workers at medical clinics.
The Prime Minister said some 3,000 public officials will be dispatched across the country, along with 1,000 military personnel to help out on the medical front. Accordingly, to alleviate the burden on the country's medical personnel, authorities are set to change quarantine rules for unvaccinated people living with someone infected with the virus. Originally, such people had to self-isolate for 7 days. But from March, they won't have to quarantine and instead will be monitored. Authorities are also thinking of making a specialized emergency room just for young children amid the growing number of new infections found among those aged 18 and below. The number of infections found in this age group has more than doubled compared to last week. As of Wednesday, they took up more than 26% of new infections. Young children under 10 make up 12% of all infections. Authorities said they would increase the number of hospital beds just for young children and teens to some 860. There's also some 95 centers nationwide that provide medical counseling and diagnosis for children and teens recovering from COVID-19 at home. Authorities are also trying to help people get tested without having to fear about having any nasal discomfort or headaches from PCR or rapid antigen tests, which gather samples from deep up the nose. They're considering a saliva-based PCR test that only requires people to spit into a tube. Once the Ministry of Food and Drug Safety gives the green light, this test will be used at screening centers and at schools. Shin Ye-eun, Arirang News.